Greetings, everyone. In recognition of National Nutrition Month, we are coming here from Neighborhood Family Practice. I am Domonic Hospon, the CEO of the organization, and I have with me today Morgan Taggert, Executive Director of the FAIR Project. And in addition to Morgan being the Executive Director of FAIR, she's also the Board Chair for Neighborhood Family Practice. So Morgan, could you tell us a little bit more about FAIR?
Yeah, absolutely. And thank you so much for having me. I've been a long-time patient of NFP, and the work that we do is just so important in Cleveland. FAIR stands for Food Access Raises Everyone, and we work with community groups, leaders, and grassroots organizations across the city who are working to address issues around disparities when it comes to access to healthy food in Cleveland neighborhoods. So we help support urban farmers, farmers markets, grocery store development, a lot of different projects across the city to really connect people to healthy food in their own neighborhoods.
Thank you. And so understanding some of the challenges that Cleveland face, we know that we are the second poorest city, and that we have a number of people who are navigating poverty and have difficulty acquiring healthy foods. Can you speak to some of those barriers that people have to accessing fresh produce?
Yeah, it really is quite a complex issue. So at kind of the neighborhood level, you have kind of where are the points of access to healthy food in your community? And that could include grocery stores, supermarkets, farmers markets, pantries, meal programs, corner stores. But some of the trends that we've seen in the city is that food environment is changing, and that a lot of the larger kind of grocery stores, full service supermarkets have left certain neighborhoods of the city of Cleveland, as well as some of the first ring suburbs. And so folks who may lose a grocery store in their community, it could be the Central community, the Collinwood community, Buckeye, those residents in those communities lose that connection to that grocery store, and then that's exacerbated by lack of access to a car that they can get to the grocery store with. So if they don't have a car, they're taking transit, getting rides with friends and family, maybe taking a ride share to get to the grocery store and then come back, taking their kids with them on that journey. So it begins to get very complicated. I think the other issue that you raise is also just around household income in Cleveland. And we are a city where many of our residents are struggling financially. So as prices go up around inflation, as they have, and changes in the supply chain, those prices go up, and then it's harder for families. Now they have to pay to get to the grocery store, and they also have to pay higher prices. And there's also less competition then, and that also can have an impact on prices of food in different Cleveland neighborhoods.
Thank you. Is there specific initiatives underway to address all of those things you just highlighted?
Yeah, there's a lot of really great work happening across the city of Cleveland and greater Cleveland. I think what we're seeing is a recognition that local organizations, community groups, and community leaders are really trying to come together to solve these issues in their own neighborhoods. And some of the work we do is helping and supporting those who are most affected by these issues to develop and really institute the solutions themselves. And so some of those things that are happening in Cleveland neighborhoods are a real expansion of urban agriculture. The city of Cleveland and our first ring suburbs have been supporting urban agriculture for a long time through community gardens and urban farms and market gardens. And there is a real, I think, desire to further expand those spaces in our city, as well as figure out ways to connect people in the community to the produce coming out of those gardens. So we have over 200 urban farms and community gardens in the city of Cleveland alone, and they're sprinkled throughout all of our neighborhoods. Some have been around over 100 years, and some were just started last year. So I think that's a community-led initiative that really can have an impact on the neighborhood, and it also shifts the culture because it's an opportunity for neighbors to talk about healthy food, how food is grown, to maybe try some new produce. So they're really important parts of our food system. Some of the other work is around farmers markets and farm stands. Most of the farmers markets in Cleveland accept SNAP and EBT and have a SNAP incentive program called Produce Perks, which doubles your value. So if you spend $10 with your SNAP card, you get 10 extra dollars for fresh fruits and vegetables. There's also other different programs that are connected with that provide vouchers so people have dignity, choice, and freedom to choose the foods that they want for themselves and their families. There's also a lot of work around pop-up markets, working with corner stores to get healthier products into those stores, connecting with places like the West Side Market and some of their produce vendors to source smaller amounts of produce in those smaller stores and community. And a lot of this work is really led by kind of socially oriented entrepreneurs, community leaders, small nonprofits, and organizations that are really working collaboratively on these issues across the city.
Thank you. A lot of what you just highlighted really speaks and hits home for me. At Neighborhood Family Practice, we are screening our patients for food insecurity, and we've tried to do our best to connect patients with resources when they do screen positive. And I'm excited about one initiative that we're working on now in collaboration with the food bank is a food as medicine program. So our patients that screen positive for insecurity, and who have a specific chronic condition, we can then refer those patients with a prescription to go to and shop, on site at NFP to get nutritious and healthy foods that aligns with the diet that they should be eating for the medicine.
Yeah, that's an incredible program, and I think it's really going to take all of us and all of our organizations, businesses, and in our communities to really work together to solve this issue. It really is foundational to health for every member of our community. So I think it's partnerships like NFP has and like FAIR has across the city that are really going to make the difference.
Well, thank you so much, Morgan.
Thank you, Dominic.
So we're wrapping up and appreciate you all for listening.